Today we're comparing the real costs of staying healthy in the United States and Mexico. Health isn't just about avoiding sickness, it's about what we eat and how we care for ourselves. For many families, health care and healthy food are major expenses. Understanding these costs helps people make smarter choices for their health and finances. Mexico has become a popular destination for Americans seeking affordable medical care and a lower cost of living. Why? The price differences are significant. We'll break down the cost of doctor visits, dental care, prescription drugs, and healthy groceries in both countries. You'll see how much it really costs to stay healthy on either side of the border. No need to be an expert. This is a simple, clear look at the numbers. By the end, you'll have a better idea of how these two countries stack up. You'll see why more Americans are considering Mexico for health care and retirement. Let's dive into the real numbers and what they mean for your wallet. Our goal, give you a clear, practical picture of the financial realities. This knowledge can help you make informed choices for your health and your budget. Let's get started. First, let's look at doctor visits. In the U.S., a basic doctor's appointment can cost $100, $300, and specialists charge even more. Emergency room visits and hospital stays can run into the thousands, even with insurance. In Mexico, a general doctor visit is usually $25, $50, and specialists are $50, $80. Hospital stays and surgeries are also far less expensive, sometimes just a fraction of U.S. prices. For example, a surgery that costs $50,000 in the U.S. might be $5,000, $10,000 in Mexico. Many Mexican doctors speak English and offer high-quality care. The lower costs mean people can get care quickly without financial stress. This is a big reason why medical tourism to Mexico is growing. The U.S. system is complex and expensive, while Mexico offers more affordable, straightforward care. For many, the savings are life-changing. That's the reality of medical care costs across the border. Dental care is another area with a huge price gap. In the U.S., a cleaning and checkup can cost $100, $300, and fillings add even more. Major work like root canals or crowns can cost over $1,000 per tooth. Many Americans delay dental care because of these high prices. In Mexico, a cleaning is $30, $50, and fillings are $40, $80. Root canals and crowns are often just a few $100s. Many Mexican dentists are highly trained and use modern equipment. Cities near the border have become dental tourism hubs for Americans seeking affordable, quality care. The savings can be thousands of dollars, especially for families or those needing extensive work. In Mexico, dental care is accessible and affordable. That's why so many cross the border for a better smile. Prescription drugs are much more expensive in the U.S. than in Mexico. A month's supply of a common medication like atorvastatin can cost over $100 in the U.S., but just $15, $30 in Mexico. Insulin and inhalers are also far cheaper south of the border. Many medications that require a prescription in the U.S. are available over the counter in Mexico. Lower prices mean people can actually afford the medicine they need. The U.S. system has many middlemen and little price regulation driving up costs. In Mexico, government regulation and more competition keep prices low. For many Americans, buying medicine in Mexico is a regular part of their healthcare routine. The savings can add up to hundreds or thousands of dollars a year. Access to affordable medicine is a major reason people look to Mexico for healthcare. The difference is clear at the pharmacy counter. Eating healthy is expensive in the U.S. and fresh produce and lean meats can quickly add up. A family meal with chicken, fresh salsa, and guacamole might cost $15 or $20 in the U.S. In Mexico, the same meal costs about half as much. Local markets offer fresh fruits and vegetables at very low prices. Avocados, tomatoes, and other staples are much more affordable. This makes it easier for families to eat nutritious home-cooked meals every day. The lower cost of healthy food is a big advantage for those living in Mexico. So for families on a budget, these savings make a real difference. Eating well doesn't have to break the bank if you know where to shop. In Mexico, a healthy diet is within reach for more people. That's a key part of staying healthy. Why are costs so different between the U.S. and Mexico? The U.S. healthcare system is privatized and profit-driven, with high administrative costs and little price regulation. In Mexico, lower wages, less student debt for doctors, and simpler systems keep prices down. The Mexican government negotiates drug prices and encourages competition, making medicine more affordable. Food is cheaper in Mexico thanks to a favorable climate, lower labor costs, and local agriculture. In the U.S., higher wages, longer supply chains, and complex distribution drive up prices. These economic differences shape the cost of staying healthy every day. For many, Mexico offers a more affordable path to good health. Understanding these factors can help you make smarter choices for your health and your wallet. The cost gap isn't just about numbers, it's about real opportunities for better living. Whether you're planning a move or just looking for savings, knowledge is power. Now you know the real story behind the price of health.